How does the thyroid affect the sexual relationship? Intimacy between men and women is the most sensitive relationship and is strongly affected by any changes or imbalances in the body functions, causing an increase or weakness in the feeling of sexual desire and excitement in the couple. The most prominent or physical diseases that affect a lot of sexual desire is the occurrence of some disorders in the thyroid gland. Because the thyroid gland is one of the most important endocrine in the body, it affects each cell of the body, and when any imbalance of hormones that produce them affect negative on the human body, which is the most intimate relationship. According to many recent scientific studies, where many studies and scientific research revealed the extent of thyroid effect on intimacy and feeling of sexual desire. The most prominent Italian study proved that disorders of the thyroid, whether the lack of functional activity or excessive production of hormones, it greatly affect the performance of intimacy and the sense of desire and sexual excitement. If the patient has hypothyroidism, he is vulnerable to sexual dysfunction and sexual dysfunction, but if the patient has hyperthyroidism, his desire and libido increases very much, while he can also weaken libido, the study said. Along with other health symptoms, thyroid dysfunction causes sexual desire to decrease by 64% if the patient has hypothyroidism, whereas if the patient has hyperthyroidism, male sexual desire may decrease by 18%. Patients with hypothyroidism are the most vulnerable to 64%. While hyperthyroidism patients suffer from erectile dysfunction 3%. Hyperthyroidism makes men 50% more likely to develop premature ejaculation and 7% in men with thyroid deficiency. The disease of delayed ejaculation is suffered by people with hypothyroidism by 64%, while patients with hyperthyroidism by about 15%. While other scientific studies have shown that in the case of disorders of the thyroid gland, impotence of women with impotence and sexual weakness due to a complex relationship with the function of sex hormone and hormonal balance of thyroid gland. As a result, the imbalance in the thyroid gland, whether the lack or increase the production of hormones in the body, they adversely affect the hormonal side, and the health of women, and the sexual side, resulting in a significant decline in sexual desire and sexual weakness. Therefore, researchers and scientists advise the need to treat thyroid disease whether there is deficiency or excessive activity and hormone secretion, through the treatment and medication and follow-up with the doctor. In order to regulate the rates of body hormones, and then reflected positively on the sexual health of men and women, and treatment of ED.